Hello, everyone. I'm Barbara Ham-Lee. The photo is disturbing, to say the least. I'm talking about the photograph of one person in blackface and one in a KKK costume that appeared on the Eastern Virginia Medical School yearbook page of Virginia Governor Ralph Northam. The formal investigation is over and the results are inconclusive. But EVMS is not done with its work on diversity, equity, and inclusion. Up next on Another View, the next phase in the EVMS quest to create an inclusive culture on campus and in its curriculum. And you can help. Stay tuned. Another View is coming up next.
Discussing today's topics from an African American perspective, this is Another View.
Hello, everyone, and welcome to Another View. I'm Barbara Ham-Lee. I am so excited to tell you that Another View is going back on the road again, and we want you to be in our live studio audience. So we will be broadcasting live from the American Revolution Museum at Yorktown on Friday, June the 28th. The show will be live from noon until 1, and we're going to be celebrating the opening of the Forgotten Soldier exhibit. Now, this is an exhibit that talks about the roles that Black soldiers played in the American Revolution, and then we're going to expand it out and talk about African Americans in all the wars that we have faced here in the United States. So come out, be a part of our audience. If you're a veteran, we would love to have you. If you are a history buff, please come on out. It is free. Go to whro.org/events and sign up. We do need you to register, but we have plenty of room, so that will be on Friday, June 28th from noon until 1. You can actually watch us make the sausage. So come on out and join us. And hopefully tomorrow you will join me at Old Dominion University in the Webb Center North Cafeteria for the Dollar Bank home buying workshop. And I am the keynote speaker tomorrow morning at 9 o'clock. For reservations, call 1-800-345-3655 or go to mortgagesformothers.com. This is a free workshop that is going to help you learn all you need to know in order to become a homeowner. So if you're interested, call us, join us, and I'd love to see you there. I appreciate that. So for many people in the Commonwealth, the racist photograph that appeared on the Eastern Virginia Medical School yearbook page of Governor Ralph Northam was a sucker punch to the gut. It's nasty recent history, but a formal investigation was done and the results were inconclusive. Now, it could have been an opportunity for EVMS to wash its hands of the whole matter, but that's not the case. Dr. Richard Hoven, President, Provost, and Dean of EVMS, tapped the President of the Urban League of Hampton Roads to put together an EVMS Community Advisory Board to assess the school on the issues of diversity, equity, and inclusion. And the CAB needs your help. So here to talk about the process and how you can get involved is Chair of the Advisory Board, Mr. Gil Bland, President and CEO of the Urban League of Hampton Roads. How are you, Gil?
Good morning, Barbara. It's a privilege to join you and your audience today.
Thank you so much for being with us. We appreciate it. And we have CAB member Susan Colpitts, founder and chief of client experiences with the Signature Family Wealth Advisors. How you doing, Susan?
Happy to be here.
Thank you so much for joining us. And also CAB members Delceno Miles, President and CEO of the Miles Agency. Welcome back, Delceno.
Thank you.
So good to have you here. So before we get into all the work of the CAB, I have to ask you guys, because we can't ignore the fact that the picture was there. I really want to get your personal reaction when all of this first came to light. Was it shock? Was it dismay? Was it, here we go again? Was it, what's the big deal? What was your reaction, Gil?
My first reaction was total shock. I know the governor, and as we all do, and I've worked with him over the years, and it was a shock insofar as he was in the photo as well as the time frame.
Mm-hmm. What about you, Susan?
I felt like I was surprised that it was associated with him. I do still hold the question as is inconclusive as to whether or not he's involved. But I went to the University of Virginia in the late 70s, and so I wasn't surprised. because what was acceptable in some people's view, we look back on it and it's distasteful. And we didn't have enough awareness at the time of what was distasteful. So a lot going on, right, as we look at that.
What about you, Delceno?
I wouldn't say I was shocked. A lot of this stuff doesn't surprise me anymore because we still have remnants of the past still with us. So I wasn't shocked. If anything, maybe hurt that was allowed to be done. Not necessarily from the governor, but whoever was in charge in the culture would allow that to happen. So here we are, and I'm a native Virginian. Here we are. This is happening, and the world was looking at us. And I just thought it was a black eye for the Commonwealth.
You know, it's interesting, Barbara. USA Today, the publication, did a survey, I think, of 900 yearbooks and similar publications of higher ed institutions and found hundreds of photos.
Right.
And it ranged not just from the medical community, but higher ed in general, from Ivy League to large, well-known public universities to private liberal arts colleges. It was widespread.
So there definitely was a culture. And as I said in my intro, I mean, EVMS, so they jumped out there, they did their investigation, it came back inconclusive. And literally they could have said, hey, we did what we did. But talk to me about your conversation with the president of EVMS.
Well, you know, the EVMS did two things. They called for an investigation, which was done by a law firm based in Richmond, and their charge was to try to identify the photographs
person, right.
and people in photographs, and they produced their report about a week or so ago. With us, I was called and asked whether we would be interested in engaging in a review of the culture of the university as it was and whether there are any vestiges remaining. But as importantly, let's examine and test the processes and environment today and whether or not that's an environment that's conducive to people of all colors and persuasions, as well as properly preparing them for a diverse society as medical care providers. As you know, healthcare is over 20% of the nation's GDP, so it's a critically, vitally important factor.
So you were tasked with putting together the advisory group. They came to you and then said, put together the group. So how did you find people like Delceno and Susan? What were you looking for?
I was looking for people that I knew had a demonstrated evidence of caring, demonstrated success and skill in working together in public transparent projects, and those with the skills and ability to debate, because, you know, among ourselves we will debate fairly intensely. But you know, with the idea of being transparent. We're 8 members, and it's a remarkable group statewide. In addition to Delceno Miles, who's a business owner, and Susan Colpitts, who's a business owner, we have the former president of the University of Richmond and dean of the School of Arts at UVA, President Ed Ayers. He's now president emeritus of the University of Richmond. We have Xavier Richardson, who is a healthcare executive at Mary Washington Hospital Group in Fredericksburg, Virginia. L.D. Britt, who is a nationally, globally renowned surgeon who's involved. Jim Wood is a pastor of the First Presbyterian Church in Hampton Roads, and that church engages in a number of wide-ranging community initiatives, and he's just a very thoughtful gentleman. Jonathan Zohr is head of the Inclusion Society.
Virginia Center for Inclusive Communities. And I'm on the board.
Well, then you know Jonathan well, and Jonathan is a renowned leader in organizing events of this kind, and myself. So it's 8 of us, and we were also we're supported by the EVMS Foundation, and knowing that this is not our expertise in day-to-day work, we're all volunteers, trying to do a public good, or at least help with a public good. We hired a firm out of Richmond called SIR, S-I-R, and they will be our actual legs in conducting surveys and interviews.
Okay. So before we get into the technical of what exactly is going to happen and what you're hoping to get from people, I'm curious from your perspective, Susan, and yours, Delceno, as to why you guys said yes. Why did you say yes to Gil?
Well, I'll start out. I think that
Susan Colpitts. Mm-hmm.
as hard as this is, I also think we can view it as an opportunity. The conversation, it seems to me, is really opening up around race. And it's hard and it's complicated, and we don't choose on any given day. A lot of people aren't going to choose to walk into the conversation. So this is a good catalyst and an impetus for us to take the conversation one level further. Mm-hmm. And I think that our businesses, our nonprofits, our hospitals, our education institutions, all have an opportunity to do the kind of the policy work, the putting policies in place, putting training in place. But the real question is, how are the environments changing? If you're a person who has any sort of minority associated with your identity, how are you treated in an organization, in your community? And I think that's what we really have an opportunity to explore.
Mm-hmm. And Delceno, why'd you get involved?
Well, because I care, and because other than our parents and my pastor, I don't think anyone else has more influence on my decisions than my medical provider. And it's important that that person treats me as someone that is unique and special and have a sensitivity to my needs. Mm-hmm. And so knowing that we can weigh in on how the next generation of healthcare professionals are trained is a big deal. Because we have, our parents and elders and others in our communities that don't feel that they're getting, they're receiving equity when it comes to healthcare provision. So, not to say that EVMS is not doing that, but as Susan said, it's a great opportunity to weigh in and take a look. And we're an independent body, so we're not truly answerable to EVMS per se. We're here to take an independent, objective look at the culture there now, and to see if people do feel that it's a culture of inclusiveness and diversity, and we're taking a look in there. We're going in with a blank slate and really just want to see and hear from not only those that are the internal stakeholders at EVMS, but that's why I know we'll talk about it in a minute. The town halls, to hear from the public and get their perceptions and their perspectives, so we can really have a more balanced view when it comes to taking a look at what the assessment is, and then come in with some possible recommendations.
Okay.
So you can see why I chose these two professionals. If you were
Susan
talking to the
joint. We're the two females on the pit. We run this thing.
Anytime you're with Delceno Miles, you take a back seat. But if you were to talk to the other five members, because their backgrounds are so broad, the effort was to select people that are not duplicative and would have a different set of eyes and ears.
Have you guys
and
met already?
We've been meeting since February.
Okay.
Yeah.
All right. And go ahead, Susan.
One other thing I think is worth mentioning, clearly the issue of race is what got us here, but I think the examination that we're doing is broader than that. I think it's important that we address the LGBTQ community as it relates to the intersection with EVMS, and really any minority, women, underrepresented in whether or not it's from a patient context, an administrator context, whether you're a medical student, physician. We're really looking at all of that.
Okay. 440-2665 or 1-800-940-2240 are the numbers to call. We're talking about the opportunity for this group to hear from you about your thoughts or about Eastern Virginia Medical School in terms of diversity, inclusion, and equity. 440-2665 or 1-800-940-2240. Okay, so you're going to hold two town hall meetings. They're coming up on the 18th, which is a week from. No, it's less than it's on Tuesday coming. On the 18th of June. One is from 10 to 11:30 in the morning at First Presbyterian Church, 820 Colonial Avenue in Norfolk. That's over in Ghent. And then the second is from 6 to 7:30 p.m. at the Kroc Center at 1401 Ballantyne Boulevard, also in Norfolk in the Ballantyne neighborhood. And what are you hoping? First of all, who are you hoping shows up?
Well, frankly, and we also added editorial in last Sunday's paper to better introduce or reintroduce ourselves to the community. We would like to have a broad outpour of the public to share their concerns, their hopes, experiences of any kind with us to help us further test the system and develop a paper that would identify best practices going forward. We would love to see the medical community be present, and particularly the African American medical community and minority medical professionals and providers to share their experiences.
And Dr. Ayers, I believe, is going to be the one to conduct
He'll facilitate the
conversation. Okay, 440-2665 or 1-800-940-2240. Since we have members here of the CAB, call us and give us some of your thoughts. They've got notepads ready to take some notes. Susan, you talked about expanding it beyond race. Sometimes when there are issues around race, and people say, well, we need to expand this, it feels like there's a dilution.
Right.
Is that the right word? That it dilutes the core problem. Are you concerned about that at all?
I understand, and actually, as I was saying that, I could hear that reaction to it. I don't. It's so complicated. I think we would be remiss to ignore the issues of people who are of a different type of minority. But I do think that race is what got us here, and that really needs to be the centerpiece. And again, with a lot of the racial work that we're doing in the community, I hope this is the first step, and that the conversation will continue as long as it needs to really address everyone's concerns.
EVMS has a really important niche in this regard. They brand themselves as being a community medical provider. That is their goal, to be the best provider to communities. And we want to help in that regard.
I think we got some phone calls. Yes, we do. 440-2665 or 1-800-940-2240. Renee joins us from Hampton. Hi, Renee. You're on the air.
Hi. How are you today?
Doing good. How are you?
I'm fine, thank you.
Good.
I just wanted to get your feel about whether or not we have a culture now in the United States that seems to provide a certain level of tolerance for the kinds of things that we have seen regarding race lately. I remember in graduate school at the University of Cincinnati, there was a popular fraternity that held something that they called a Martin Luther King Trash Day. And the criteria that you needed in order to be admitted was everything from a bucket of chicken to being in blackface to all sorts of different things that were horrendous. We protested as a African-American community on that campus in 1980. But I was wondering, here we are close to 35 years later, or over 35 years later, and we still have the same kinds of tolerance toward this. And I just wanted to know what the group felt as it related to the culture now.
Okay, Renee, thanks so much for the call. We appreciate that.
I take no exception to what Renee shared. I think that's probably true. With that said, I think higher educations have a unique opportunity to help shape thought and define future behavior. And ultimately, that's what we're trying to define as behavior. You know, we can't really determine what a person thinks, but we can get engaged in their behavior. And that's the role of higher education.
Delceno, you wanted to respond?
Well, yeah, she's true, and but going back to sort of the charter for the CAB, is we are going to be focusing on EVMS versus sort of the broader universal culture of higher ed. And we're taking an objective look. Matter of fact, sir, the consultant we're hiring, we're working alongside them. We didn't just turn it over and just and just sitting and waiting. We're very much engaged. That's why we wanted this town hall. This is the leadership of the CAB doing the town hall, not the paid consultant. We're still volunteers, and what the consultant is helping us do, the one-on-one interviews with a cross section of folks. Again, they're working with the internal stakeholders. Our group, the volunteers, are working with the external, because that's where our influence is. That's that we live there, we work there, and we know a lot of the folks. And as Gil mentioned, that we want to make sure that it's an invitation to all who care about this issue and who have ideas. It's not there as a soapbox for people to just vent. We want to hear your concerns, but at the same time, we want to hear ideas and some suggestions, some things to move forward and make things better. So we're doing focus groups. We're also having the one-on-one interviews along with that. So it's a very comprehensive approach to getting feedback from the community.
Have you done some focus groups already?
They have.
They're started.
They have started. So,
Okay.
We'll be working hard during the summer and the fall, and we should be able to deliver a report of those findings and recommendations sometime in the fall.
Okay.
We want our recommendations to be actionable.
Right.
Ah, great.
Yeah.
Okay.
That's
All
right.
440-2665 or 1-800-940-2240. What have been your experiences with EVMS concerning this idea of diversity, inclusion, equity, racism? Give us a call, 440-2665 or 1-800-940-2240. Richard joins us from Newport News. Hi, Richard. You're on the air.
Good afternoon. Always enjoy the program, but I think y'all are talking around a subject that you're avoiding, which is academic achievement. Everything should be merit-based, but we're not, that's too big a subject. But if you're talking about admittance to a school, that's what you're talking about, right?
No.
Admissions would only be one factor, and admissions are something that we will test and examine. But that's but one factor.
You're talking about the whole culture of the school,
right?
Where everything from curriculum to
even when they
what's
get there,
on there.
Yeah, the experience while they're there. It's beyond admissions. It's a whole night. It's their experience there. It's the attitudes of the instructors. It's the attitudes of those students. What are they being taught? Admissions is just one factor. We're looking at the whole thing. What's the perception of EVMS in this community? So we're looking at a bigger picture than just admissions.
Okay. Thanks, Richard, for the call. We appreciate that. Did you want to add something, Susan?
Yeah. Delceno says it all.
So do you guys get the sense that this is something that is really at the top of EVMS's list of priorities? I mean, are you really, or are you feeling like, okay, we're going to do this work, we're going to turn this over, then what?
I do sense that. But with that said, Dr. Homan and I agree that once the commission was formed, our communications would cease. We're hands off.
Interesting. Okay.
I've not chatted with him at all since the inception of this committee, and that's how it should be. Because we will go where the facts lead us, but it's not with an idea of got you or caught you. This is a public institution serving the public in a vitally important area, healthcare.
This is a fairly new institution, though, compared to medical colleges all across the country. It's a baby school.
We have 4 medical schools in Virginia, and this is the third youngest,
right?
Yeah.
Right. So are you surprised that it would be the catalyst or the leader in this endeavor?
It's interesting that I think that talk about a gotcha. Right before this whole story broke, Dr. Homan was informed that the medical school had won a national award for the diversity and inclusion programs. And then this pops up. It has medical schools are competitive for students, for faculty. And I think this is part of their image, which is terribly important. And again, so as challenging as this is, we give them credit for asking the question, for moving the ball forward and creating uncomfortable conversations and having people tell the truth and learn what we can learn from it.
And that's why in the beginning of this conversation, I offered the context of the USA Today survey, where they examined 900 higher ed medical school publications and found hundreds of examples of similar.
So the EVMS is not alone in this. If you're just joining us, we're talking about the efforts of the EVMS Community Advisory Board to assess diversity, equity, and inclusion at Eastern Virginia Medical School with CAB Chair Gil Bland, along with CAB members Susan Colpitts and Delceno Miles. Join the conversation at 440-2665 or 1-800-940-2240. The Community Advisory Board is interested in hearing your experiences with Eastern Virginia Medical School. So you may as well give us a call right now and start that conversation. 440-2665 or 1-800-940-2240. So why is it important? Maybe we need to remind the audience why it's important for medical care professionals to be cognizant of equity and to be cognizant and practice, fair treatment. Why is that so critical, Gil?
Well, it's very broad, and I'll go from the macro to the micro. Healthcare disparities are generally accepted as in place, and color, geographical location, income, all of these factors have impacted healthcare. And in the city of Norfolk, for example, there are neighborhoods who have the difference in 20 years of life expectancy.
Right. From zip codes.
From zip codes.
Yes.
It could be 3 miles apart and 20 years difference. So we understand that healthcare disparities exist in the macro. But then, when you push it back more to the micro, the medical schools have a large ability to shape the attitudes of future medical providers, with the culture, their orientation, the awareness and sensitivity to the patients and very diverse patients that are serving. The demographic data suggests that America is continuing to brown. And by 2040, what was heretofore minorities will be majorities. So it's a population that young medical students will be serving for the upcoming decades.
Mm-hmm. And then, I was reading an article about, it happened to be the Robert Woods Johnson Hospital, and looking at their leadership. They're talking about the lack of diversity in hospital leadership across the board. They said 32% of minorities make up the patients, yet they only hold 11% of executive leadership positions at hospitals. That's down from 12% in 2013, according to the American Hospital Association Institute for Diversity and Health Equity.
I'll add one more alarming statistic. Sure. African American males enrolling in medical school are at 1977 levels.
Wow. Yeah, we did a show actually on that very issue with EVMS, because we were talking about how they are going to recruit and bring in more African American males to become doctors. 440-2665 or 1-800-940-2240. Geraldine joins us from Norfolk.
Hi, good afternoon.
Hi.
I recognize I try to examine everything from every angle. But just because I don't recognize something as racist doesn't mean it doesn't exist. I do understand that. On that premise, I'd like to tell you I am a very happy patient at EVMS. I've had a horrible skin cancer treated at the dermatology clinic. I go to Get Family Practice on a fairly regular basis to take care of the things that are little nuisances of life. And I happen to work in the area, so it's just beautifully convenient for me. Mm-hmm. And on that note, I don't think a stupid, moronic event that happened in 1984 should tarnish this fine organization. I have nothing but respect and gratitude every time I walk through that door for any clinic that I go to, because I am treated so beautifully. And when I go there, there's a whole collection of humanity there. It's not just a cookie cutter this, cookie cutter that. It's all that's the best in this community can be found in these clinics that I go to. And with that, I'd like to just say thank you.
Thank you, Geraldine. We appreciate that phone call. It is fine that an institution examine itself, would you say?
That's right.
Yeah,
absolutely. And again, this is not an exercise in trying to disparage EVMS. This is an opportunity. To their credit, they contacted Gil, and Gil contacted us, and we've been working very hard since February to get our arms around what we're trying to do, and we're trying to take an objective look at the culture there, and from our various lenses. We have 8 members, and we have 8 different lenses, and that's how we're looking at this. And so I applaud EVMS for even reaching out to Gil, because they didn't have to do that. And the fact that they're hands off. We're an objective, independent body, and we've been working hard for the last few months. But we really want this to be a transparent process, and we want as much community engagement as possible. Hearing Geraldine's comments is wonderful. That's the sort of thing we want to hear too. But for every Geraldine, there may be someone else whose experience is a little bit different, and we don't want to discount anyone's experience, whether it's positive or negative.
I'm curious as to what the conversation has been among the group. How did you guys start? When you came together the first time, the different conversations, without naming names or anything, but I'm just curious as to how you all came together, because like you said, you're 8 different people from 8 different lenses. How did you
unanimity.
gel? Yeah, right.
Well, after Gil ordered lunch and our blood sugar came up, we were good. But it was just like some of us knew each other, but it was just really a time to get to know each other and where we're coming from. I think that was the first meeting, was pretty much dedicated to getting to know each other and to trying to get that rhythm. And then after that, Gil is a very strong leader in terms of he helped us he started off with a draft charter to work from, and we all looked at that, and so we could narrow our focus. We could have been all over the map, but we wanted to narrow the focus and be productive in what we were doing, because all of us are busy people, but we care enough to take the time to do this, to volunteer our time to come out with something that's good for the community. So this is more than about EVMS. This is about a partner, a community partner that transcends everyone here that calls Hampton Roads home, whether it's and they did give us a bit of a presentation about the things they're doing, and they're doing wonderful things, Barbara, but a lot of things that people just not aware. Great, wonderful things, the experience that Geraldine's having, but they have partnerships, and so this is an opportunity perhaps for EVMS to step back and take a look at how can we be a stronger partner in the community, not so much for show and tell, but to really strengthen and leverage what they have, and have others share their story like Geraldine has.
I'll just very quickly say the environment when we began was very tense because that was national news. So we were working through that also. But because the members in the committee are so strong, we seek consensus. And there's no one person. This is a team.
Teamwork.
I think wanting to really understand. I think that, Gil started talking about kind of the macro, the demographics. I think what we all know is that the opposite of that is the micro, which is the relationship between a medical professional and a patient. And as it relates to health disparities, all it takes is a bad interaction for a patient to put their hands up and go, you know what, that didn't work for me. And so what we really want to try to understand is the implicit biases that we all bring. I think the area of implicit biases is fascinating, and it's really, what are the habits of how we perceive each other? We all have implicit biases, and I think the first caller called into question, have we progressed? And I grew up in Memphis, and I am not happy with where we are, but I'm really happy we're having this conversation, and I think that people are in the conversation with courage and a real desire for transparency. And I think that's true for us 8. I think it's true for the medical school. and for all of the community members who step forward.
One of the points that you brought up about the whole idea of implicit bias and so forth, according to the Institute of Diversity's benchmark study, 79% of hospitals require employees to undergo cultural competency training to gain a better understanding of other cultures. But Hobby, who is one of the people in the article, argued that the intimate knowledge of a culture cannot be taught. Having diverse leadership and staff is a better way to reduce disparities. So as you find out more from the community and you all put down your recommendations, that might be a direction you may find yourself going in. Let's talk to Ann in Norfolk. Hi, Ann. You're on the air.
Hey, how are you? Thank you for taking my call.
Sure.
I've been listening to your discussion, and I wanted to point out that I run a magnet program in the public schools in Norfolk, a high school, that was created as a partnership between the Eastern Virginia Medical School and Norfolk Public Schools back in 1986 to specifically address the disparity in the number of minorities and females at that time in 1986 that went into the medical field. This program has been in existence since 1930, for 33 years, since 1986, and it's designed to support young students exploring medical professions. And quite honestly, there are many diverse students from this program who are now in the local community who have gone to the Eastern Virginia Medical School in areas and programs other than just the MD program, or they've been in the surgical assistant program, they've been in the Med Masters program, they've been in the public health program. So I think from the get-go, it seems to me anyway, that EVMS recognized this early on, that it was a problem and an issue, and proactively sought a means to not only serve their mission, which was to create a very community-focused medical school, but to also address the needs of the community. And again, I'm still very active with this program. I'd be glad, though, to take your comments off the air.
Okay, thank you so much for the call, Ann. You guys want to react to Ann and her work? Go ahead, Susan.
I know that program, and I know it's really strong. One of the things we talked about early on, because EVMS is a relatively young school, their endowment is not as big as the UVA, MCV. Therefore, there are fewer scholarship dollars, and I think this is something that Dr. Britt has talked about a lot, and it's really important that the less scholarship dollars we have here in our community for medical students or the other professions, the harder it is for people with economic challenges to get in that direction. So for you donors who are listening, I think building up the scholarships for minority students it would be a really strong outcome from the awareness that we're building here.
I would add to
Gil.
this whole conversation is complex on so many different levels. I grew up in rural Virginia, and I dealt with watching my elderly parents go through healthcare and end-of-life issues, and folks in rural environments, particularly if they're not well educated, are fearful. Yeah. And if the medical provider doesn't understand that, and that they have to work to get the answers and work to get cooperation and engagement, medical care just won't work.
Exactly.
And building those bridges is really what we're trying to understand to so many different facets of the community.
Do you want to add anything, Delceno?
No, I don't disagree with what Ann is saying, but that's my case in point. That's a wonderful program, but we need to raise awareness about what they're doing.
Well, I was going to say, one of the things that I'm wondering if you guys will find out, and it'll be interesting when people come out to the 2 town halls to talk about this, but the whole perception of exactly what EVMS does in the community. Right. I mean, I think a lot of people may think it's just a school because you want to be a doctor, and it's apparently a lot more than that. Yeah. So that may be something too. Go ahead.
They're really focused on the community, more so than most other medical schools. I happen to know they went through strategic planning a few years ago and realized that was a real distinction they could make to create a community-focused school, which raises the bar really for them to do that effectively. by being able to walk into a community with big ears and a big heart and make a difference in the lives of the people in those communities. And so I think that's another reason that this work is so important. I know that there are medical students are in our public housing projects in the summer, hanging out with the kids and looking in their ears and listening to their hearts. And they need to be doing that in a way that's appropriate.
It's appropriate.
And we don't have any reason to think that they're not. We just need to ask the question.
Another stat that I found, which I thought was a little bit amusing, but and you'll see why. So minority representation in every C-suite position within hospitals has either decreased or remained flat since 2013. That is, except for the Chief Diversity Officer position, with minorities representing 77% of those with that title, up from 58% in 2013. So, and I know EVMS, I know the Chief Diversity Officer at EVMS. He's a very cool man. But the point is that window dressing, or is that an effective way of trying to make change? And I know that's something else that you guys will need to look into. I'm just curious as to what your personal thoughts are about that.
I think it helps to check the box in case somebody's watching. And I think many of them are doing good work. But I think through this whole exercise, quite frankly, Barbara, this is EVMS should strive to be ubiquitous in this community, much like their peers, if you will, in other communities. People know about UVA school, they know about MCV, and then right across the street from here, ODU's everywhere, sort of like the town bank of colleges here. Town bank is everywhere. Did I just give an unintentional plug to town bank? But anyway, a local community bank.
Exactly.
But that doesn't always take money. You don't have to write a check for all this stuff. It's just to make sure, because all of us go to various events, and I rarely see someone from EVMS there.
Yeah.
And I think that if they serve on boards or open up the college for public community meetings and things like that, people will get to know them better. It's sort of like having that neighbor over the fence. You really don't really interact with them very much, but you know they're there. But and I think they can control their own message, if you will, if they just get out there more. And so striving towards being ubiquitous, I think, is something that they need to take a look at. And having these officers in place, it's a start. But I don't see him either out there in the community. Yeah. So, you have your wonderful forums with Race Let's Talk About It. Are they there? I don't know. Right. But to have those conversations and to be at the forefront of these conversations is important. Not when there's a crisis, but have an ongoing conversation throughout this whole process.
And that's the thing that I am hoping that once you guys, so at the end of this process, Gil, you're going to compile all your information and
there's another opportunity for community engagement. We're going to do an online survey.
Okay.
Community-wide.
Community-wide, probably in August or so, and we'll be seeking additional input. I mean, we really want this to be, as our name states, community advice. Community advisory.
What are you guys doing to reach people? Oh, I'm sorry, Lisa. Let me quickly take that call. Garrett joins us from Chesapeake. Hi, Garrett. You're on the air.
Hi, good afternoon. You guys are doing a great job.
Thank you.
My comment actually had kind of been taken. I wasn't aware that there was a program that had some of the medical students to go out in the community during their off sessions, or, to kind of get involved with people of different ethnicities and different backgrounds to make them, because earlier in the conversation, you guys were talking about the way people think. The only way to really change a person's mind is to have them give of themselves. That changes you. And when you volunteer, you can't help but get ingrained with these different personalities that now become real people instead of objects that you see or weren't exposed to before. So I wanted to applaud EVMS as well for actually reaching out, because like Geraldine, she's very happy with the service and everything that she's getting. But in any organization, I'm a father. There's things that my children have done that I don't know about. But if someone brings it to my attention, my whole point is to try to correct it so we can be a great family.
There you go.
And I applaud EVMS for coming to Gil and coming to you guys to actually try to make it better for the community, make us all whole. anytime there's a breakdown, we need to try to fix it. And I applaud you guys for doing that.
Thank you, Garrett, for the call. I appreciate that. So clearly there's community interest out there. We just to remind you that from on June the 18th, from 10 to 11:30 a.m. at First Presbyterian Church, 820 Colonial Avenue in Norfolk. And the second opportunity is that same day, June the 18th, from 6 to 7:30 p.m. at the Kroc Center, which is at 1401 Valentine Boulevard in Norfolk. And if you haven't been to the Kroc Center, it's a gorgeous building.
Very nice.
So you should really come out and check it out. Just make a plug for folks who haven't gotten over there to see the Kroc Center yet. But what are you doing to reach more marginalized communities in our last couple of minutes to make sure that they also are participating?
Well, as you know, I'm CEO of the Urban League, and we have it posted on our website. I've reached out to the NAACP, to fraternities and sororities, just my own personal Rolodex, if you will, to ask them to advertise. I've contacted the African American Medical Society in Hampton Roads. Anyone that will listen. And in addition, we wrote a op-ed in the newspaper last Sunday that I'll refer the listeners to. We want this to be transparent. This EVMS was formed from the communities. I mean, initially, I think the board was made up of community members appointed by the city councils of each of the sub-sized cities, and they have since morphed into a statewide public institution where the governor also makes appointments to the governing structure. But this is the community, and this is us, and we're a small enough community that we can talk to each other, listen to each other, and challenge each other.
Okay.
Challenge is a good thing.
Exactly.
Yeah, we reached out to the faith-based community, grassroots organizations like Committee of 200 Plus Men, and just folks out there who are the STOP organization and groups like that who do help us reach what, as you put it, the marginalized, the underrepresented, and to come. And we're going to take their advice seriously, and we're not naming names in the report. There won't be any attribution, so if people have concerns about their names being in the report, no names will be in there. And these interviews that we're conducting in focus groups, it's all anonymous. So we want people to feel empowered to tell us and encouraged to tell us their story as it relates to the EVMS as a resource in the community.
Well,
one thing for certain, all of us are going to be touched by the medical community at some point in our life.
Oh, yes. No question.
That's right.
No
so
question.
this is for everyone.
Yeah.
So as everybody who has seen me on television knows, I also am the spokesperson for the St. Paul's area revitalization initiative. So I will post this on their website too, so that we can make sure that all communities are included and can come out. All right, we're almost done out of time, but to remind you once again, 10 to 11:30 a.m., First Presbyterian Church, 820 Colonial Avenue in Norfolk. That's on the 18th of June, next Tuesday, or 6 to 7:30 p.m. at the Kroc Center, 1401 Valentine Boulevard in Norfolk. Come out. Give your opinions. Let us hear from you. And thank you all so much for joining me, and we'll be right back.
Hi, I'm Claude McKnight of the group Take 6, and you're listening to Another View.
There's a new sun rising. I can see a new rising. People keep me realizing you're the biggest part of.
And welcome back. Dozens of Parkway Elementary School students recently got a chance to let their creative juices flow by helping their artist in residence, Marcus Bowers, design a mural for their school. Our Lisa Godley was there when Bowers and his young proteges unveiled their creation, which colorfully celebrates their dreams for the future.
For dozens of Parkway Elementary 4th and 5th graders, their latest art project is much more than an opportunity to paint pictures and splash color. It's their unique expression of what they dream of and desire for their future.
It was a good way to let other people come to know us as 5th graders, what we like and what we want to be.
The students spent 8 weeks creating a mural with their artist in residence, Marquise Bowers.
I painted on 7 panels of plexiglass with acrylic paint. On the plexiglass is a sketch of a student and what they would like to be when they grow up. So it varies from a chef, a astronaut, in the military, or aquatic engineer. And I wanted to illustrate that because I wanted the children to see themselves as that person. I wanted to create an outdoor scene since it's an outdoor mural project that will be on the fence. So I have trees and flowers and small pets and clouds and birds in the background. And in between the 7 panels are small panels of plexi that each child had the opportunity to create in class.
We started making swirls on the red ones. We had to share the glass, and someone made swirls with it. They just went with the red also.
White and yellow swirls, and we added stars to it. We went for a devilish space theme.
2 of the young artists, Kamari Sanderson and Kamora Davis-Day, were more than happy to share a little of their experience.
I'm not that good at drawing, but my family said I'm good at painting. It's because when I was little, I used to do finger paint and paint on paper and stuff. It's because I really don't like using brushes that much.
What was it like working with Marquise?
It was actually fun. I'm glad I worked with him. He was nice and fun. He was actually creative. He's good at drawing people. It's fun working with Marquise.
It was a great change for me because I've never worked with a professional artist before, so it was great to experience how great things can turn out when it starts from a slow process.
They had opportunities to ask me all type of questions from why do I paint, what type of paint do I use, why do I use this color, how do I mix that color like that, what am I painting on, just all types of questions, and I was there for all of it.
My name is Riley, and Marquise wasn't just an artist, but a good friend. He showed a great amount of interest in us.
I asked Virginia Beach School's visual arts coordinator, Chris Buhner, how all this came about.
The Art Commission came forward with a grant to support the schools with local artists within the Tidewater area to come into the schools and work with students. And so Marquise had applied. By chance, I had seen some of his artwork out in the public, so he was excited about the opportunity. So we had some planning meetings with Parkway Elementary and the Arts Commission, and just kind of blossomed from there.
And Principal Krista Barton-Arnold couldn't have been happier that the talented students at Parkway got an opportunity to shine.
We wanted them to be able to reflect on themselves and see themselves in their art, but also see their future and see their future as bright. We also wanted the public to know we're here, to be visible, to be seen, and to know we're more than just our stats and our data on being Title I and 100% free lunch, that doesn't tell our story. And we wanted to tell our story through another way, which was art.
The mural will hang on Parkway's fence facing the heavily traveled Princess Anne Road for at least a month. Then it will become a more permanent fixture at Parkway. Meanwhile, artist in residence, Marquise Bowers, says he's looking forward to completing his master's degree at ODU and working on some projects near and dear to his heart, like illustrating children's books. For Another View, I'm Lisa Godley.
I love what that principal said. We are more than stats. We are people. That's just fabulous. And not only did Marquise Bowers spend 8 weeks as artist in residence at Parkway Elementary School, Marquise is also a former Another View intern. Go Marquise. We wish him the very best in his future endeavors. Thank you so much for spending an hour with us today. Be sure to tell your friends about Another View and remind them that they can always listen to the podcast. You can find it at anotherviewradio.org. And while you're there, please sign up for our eView newsletter. It's a once-a-week reminder of upcoming shows. We're on Facebook, so please like us, and you can find me on Twitter at Barbara Ham Lee. Next week, the backstory of how the Commonwealth of Virginia finally said, quote, "I'm sorry," to those impacted by massive resistance, particularly in Prince Edward County. A fascinating Another View history lesson. Our theme music was composed and performed by Jay Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer, and Jordan Yowell answered our phones. I'm Barbara Ham Lee. Thank you so very much for listening to Another View.